Today, we're going to dive into something that, let's be honest, we're all going to experience, but we often really misunderstand: aging. We're not going to look at it as just a decline. Instead, we're going to explore it as a profound transformation, a totally different way of experiencing the world. And that's the journey we're on together.
So let's just start with a big question, right? How does the world actually change when you age? I'm not just talking about what we see on the outside. I mean, from the inside looking out. How does it feel? How does it sound? How does it look different? That's the perspective we're trying to get.
Okay, first up, let's talk about the physical side of things. The body tells a story, and in our later years, that story enters a chapter of really significant change. We're going to break down what's happening to our major systems, and more importantly, what that actually feels like day to day.
You know, this slide right here, it gets to the heart of so many misunderstandings. With some loss of brain cells and less blood flow, it takes longer to react. This isn't about not understanding, it's about a change in processing speed. So, when an older person can tell you a story from their childhood in perfect detail but forgets what they had for breakfast, that's a totally normal part of this process. It means our patience, our willingness to repeat things, those aren't just nice gestures. They're absolutely essential tools for communication.
Now let's talk about the body's largest organ, our skin. As it gets less elastic and blood vessels become more fragile, the impacts are pretty immediate. I mean, a tiny little bump can cause a big bruise. And because of decreased sweating and tissue, it gets a lot harder to regulate body temperature. It's why an older person might be grabbing a sweater in a room that feels totally fine to you. And it's why a gentle touch is so important, to prevent the skin from breaking. And of course, mobility. That's a huge one. As muscle fibers get thinner and joints stiffen up, simple movements, like just getting out of a chair, can take a whole lot more effort. And then you add in the fact that bones can become more porous and break more easily. Well, you can start to see how a person's confidence in just moving around their own home can really take a hit. It's a fundamental change in how you exist in your own space.
All right, let's talk about the body's engine room, the heart and lungs. They start to change their output too. A less effective heart muscle and narrower vessels mean healing takes longer and, blood pressure often goes up. You pair that with changes in the lungs, and it just becomes physically harder to breathe. And that directly hits your energy levels. So an easy walk that you used to not even think about, that might now be a pretty tiring activity.
Okay, so we've looked at the body's internal systems, but what about how we perceive the world around us? I want you to just imagine for a second. What if the volume, the color, and the clarity of everything around you just started to shift? For a lot of older adults, that's not imagination. It's their everyday reality.
So check this out. It's not just about needing reading glasses. It's way more than that. It's about light sensitivity. A bright, sunny room could actually feel blinding because of glare. And this is fascinating. Altered color vision. Blues and greens get harder to tell apart, while yellows, oranges, and reds really pop. The very palette of the world can literally change.
So what can we do to help? Well, these interventions are super practical, and they make a huge difference. Let's take that last one. Give a verbal warning before acting. Think about it. When your peripheral vision isn't what it used to be, someone suddenly touching your arm can be genuinely startling. A simple, "Hey, I'm just going to place this on your right," makes the world feel predictable and safe. It reduces a ton of anxiety.
Hearing loss is another one of those profound changes that's so often misunderstood. It's not just like someone turned the volume down on the world. It's about losing the ability to hear high-pitched sounds, and those are crucial for telling consonants apart. That's why speech can sound muffled or garbled, especially with background noise. It can turn a lively family dinner into a really frustrating, isolating experience.
Okay, if you take one thing away from this slide, let it be this: do not shout. Seriously, it can actually make things worse. The key isn't how loudly you speak, it's how you speak. Lowering the pitch of your voice is way more effective because those lower frequencies are just easier to hear. You combine that with cutting down background noise and using short, clear sentences, and you can really bridge that communication gap.
Now get ready for this number because it's pretty startling. By the time we're 60, most of us have lost about half of our taste buds, and the ones for sweet and salty, they're often the first to go. Now, remember that a huge part of our sense of taste actually comes from our sense of smell, which also fades, and it becomes really clear why food can lose its appeal, and that can directly impact appetite and, of course, nutrition.
We've covered a lot on the physical and sensory shifts, but now we need to turn inward to the emotional and psychosocial landscape of aging. This is where we start to grapple with some of the most profound changes of all.
Before we talk about all the changes, let's lock in on what stays the same. And this is so important. Our personality, the core of who we are, that's stable. An older person who's going through all this change is still the exact same person they have always been. They have the same character, the same history, and remembering that, well, that's fundamental to providing empathetic care.
So while the person remains the same, their world is radically altered. What this chart is showing isn't just a list of hard things, it's showing the compounding effect of them. These losses of a partner, of friends, of independence, of social roles, they often happen one after another, in quick succession. It can create this overwhelming cascade of grief and adjustment.
And the emotional impact of that cascade, it's immense. Loneliness, feeling worthless, depression, these are all very common and, frankly, understandable responses. When your world starts to shrink and your physical abilities decline, it is so easy to feel insecure and pull back from others. These are not signs of weakness. They are the heavy consequences of profound loss.
Okay, so given all these complex changes, it's not surprising that many older adults will need to navigate the healthcare system. But this new world has its own, sometimes confusing, language. To really understand their journey, we need to understand the terms that define their care.
It's absolutely crucial to get the difference between acute and chronic care because their goals are totally different. Think of it like this. Acute care, like in a hospital, that's a sprint. It's intense, short-term treatment for a sudden problem. Chronic care, on the other hand, say in a nursing home, that's a marathon. It's lifelong management for conditions that are treatable but not curable. Understanding that difference is key.
And you know, the words we use matter too, because they really do reflect the setting. Someone in a hospital is a patient, but someone in a long-term care facility is a resident, it's their home. And someone getting care in their own house is a client. These little distinctions, they help honor the person's environment.
And the complexity of care in that marathon, it can be absolutely staggering. It's very common for a resident in long-term care to be managing 8 or even more chronic illnesses at the same time. We're talking about things like diabetes, dementia, Parkinson's, and hypertension all at once. This requires a highly coordinated and incredibly knowledgeable approach to care.
So, we've journeyed through the body, the senses, the inner world, and the care system. How do we pull all of this together? Well, it really comes down to a single, powerful idea. This is the goal: holistic care. It's a simple phrase, but it means we have to look beyond a diagnosis, beyond a physical need, and see the entire person standing in front of us. And holistic care really rests on these 5 pillars. Of course, you have the physical, but you also have to address the mental, the emotional, the spiritual, and the cultural aspects of a person. It means respecting their life story, their beliefs, their joys, their fears. True care isn't just about keeping a body alive, it's about honoring every single part of the person living inside it. And that brings us right back to where we started. Through all of these changes, physical, sensory, emotional, the core person remains. The only thing that really changes is our perception of them. So the final question is for you. How will you choose to see them?